Hello and welcome to our monthly live sleep chat. I am Mar DiCarlo. I am the founder and director of education of the International Parenting and Health Institute.
And I'm Soda Kuchkowski. I am the English instructor for the Integrative Adult Sleep Coach Certification Program. And I also own my own business, which serves as a community resource for sleep health education.
Thank you, Soda. And today, starting off the new year, we are going to talk about a very important topic on how health professionals can support sleep to improve the well-being for under-resourced communities. This is a very important topic for us because, as some of you may know, and some of you are going to learn just now, the International Parenting and Health Institute is transitioning to a nonprofit organization. And as we're in this process, we are looking to provide more support to those that are under-resourced and need our help. And we thought that by starting off the new year talking about this very important topic and how health professionals can support the under-resourced communities, as well as those of you who are not health professionals but want to learn some tips, we're going to share those with you today. Before we get started, we also just want to acknowledge and send our thoughts and prayers to all of those affected in Turkey and Syria from the earthquake. We have heard, and we're very, very sorry for all of you that are affected. So we're with you. We have a huge network in Turkey. We have IPHI Turkey. And thankfully, we have not heard that anyone close to us has been affected, but still we have families, friends, and so on. So we send our thoughts and prayers. All right, to get started, let's talk about some of the statistics. Let's talk about how those statistics are actually affecting the situation and this theme that we're talking about today, because the statistics will be very telling, and I think will raise a lot of awareness on why it's important for health professionals to get out there and to speak about this and to provide as much support as possible.
Well, when it comes to people of color, statistically speaking, when it comes to sleep disorders, medical sleep disorders specifically, we see quite a multitude. So it says Black people were nearly 5 times more likely to get short sleep, defined as 6 hours or less per night, and 50% more likely to have poor sleep quality, which is a lot of what we focus on here at the International Parenting Health Institute, because as we know, a lot of challenges, regardless of whether or not they're medical in nature, lifestyle, behavioral choices can have a huge impact on that. Hispanics are 47% more likely to have things like sleep apnea and 80% more likely to get 6 hours of sleep or less, as well as 39% more likely to have poor sleep quality and 28% more likely to have insomnia. And, in terms of other data as it relates to other racial and ethnic minority groups in America, unfortunately, there isn't a lot of information that has been gathered. So there's a lot more data and research that needs to be done in order to really gather and to apply a lot of what needs to happen in order to really narrow the gap on the health disparities that we see.
Thank you for sharing those statistics. We're now going to look into the reasons for this. There are many reasons. A lot of these reasons we can do something about, and that is why Soda and I are passionate about the work that we do that specifically does focus on health and lifestyle. And while there are some great challenges that these minorities and under-resourced communities face, there are steps that you can take. And as health professionals, there are ways that we can empower these communities. So let's begin talking a little bit about, I'll mention a few, and then Soda, you can continue, some of the reasons and causes for the lack of sleep and these sleep disparities happening right now. The stress. Stress is huge because there can be some financial concerns, not enough money to pay the bills. You can be living in a very noisy community, a community that has a lot of light pollution. Maybe you're living in a neighborhood that is not as safe, and so you're concerned all the time and you have that stress that something may happen in that regard. There might be a shift worker, so you might be working in a circumstance where you're working a job that is throwing your sleep off and your sleep cycles off because you're working nights all the time. You might have lower access to healthcare. Because you're concerned financially about things and stressing out, you may then be consuming foods and your nutrition is very poor. You might be eating a lot of fast foods as a result to compensate. And you also maybe too tired to exercise, and you think, I'm too tired to exercise, forget exercise, I'm stressed out. And so then exercise is lacking as well. And then again, depending on your background and your history and culture, discrimination. And that also may be huge worry on you as well, and your impact and experiences based on what's happened to you and so on. So there's a number of reasons why you may be feeling this stress and why your sleep is completely off. Is there anything else you wanted to add to that, Soda?
I think, I mean, you hit on really all of the important ones. I think in terms of this talk for today, one of the things that's the most important is about having that conversation. I think one of the biggest deterrents is that while we want communication, right, and we want to open up that dialogue, we want to start those conversations, a lot of times we're not having the same conversations. Because if you think about who's treating versus who is being treated and what those conversations look like, what home life, they're starting to ask questions like, do you have a safe home environment? Do you find that you have enough food to eat? So they're addressing things like food insecurity, but they're not realizing what the home life looks like. So it's, you can't address a lot of these things when you talk about nutrition, right? But then if someone lives in a food desert, so it's like, it has to be comparable to what are the resources that are available, right? And what is realistic. So a lot of times if there's a disconnect in the communication, so it's well intended, but the message isn't reached, and it actually often makes an individual feel alienated versus helping them overcome the situation that they might have. And we see a higher likelihood for things like cardiovascular disease, diabetes, a lot of these chronic medical conditions. And we know that sleep is a factor that contributes to this. For the American Heart Association for many, many years kind of pushed aside that sleep wasn't a factor. And we know in the last year, they just listed sleep as the 8th pillar for a healthy heart. I mean, right now it's Healthy Heart Month, and quality of sleep is something that is a recurring message in a lot of what they're putting out there. So I think just even starting the conversation of why sleep is important, because it's a missing piece in that. When we talk about that puzzle of health, a lot of times the conversation isn't even at the table, and then meeting people where they're at, I think, is going to be an important part of this. Obviously everyone has different stresses. In minority and marginalized communities, obviously there's a higher level of stress because of culmination of additional factors. But I think it's about creating a dialogue that makes sense.
Mm-hmm. And you hit a really key point in terms of customizing and meeting the communities where they're exactly at and what they specifically need. You can read all the sleep tips in the world. There's tons out there. Everywhere on social media, newspapers, magazines, everywhere you go, there's tons of podcasts, YouTube on sleep tips and how to get the best sleep. But if you're in a situation where your sleep is lacking because of financial stresses, because of food resources, because of healthcare, et cetera, those are really not going to feel practical or realistic for your situation. Having those conversations. So let's start with the health professionals. Health professionals. One of the things that the International Parenting and Health Institute is going to be implementing going forward is that part of our final project is always working with volunteers. Part of our final project will now include providing to our under-resourced communities a workshop. And we're going to start making this more and more, because anyone who is in the coaching field, whether it's sleep like we're talking about today or nutrition, whatever line of coaching field you're in, to be able to give back, to be able to contribute something to those that are in need besides people who are paying you, I feel is our duty and is our responsibility. And also helps us learn a lot more, and fine tune the ways that we are communicating. So as health professionals, how can you begin to understand in your own community what is happening? If you live, let's say, in a well-to-do community, well, what are the nearby communities around you that may not be well-to-do, that are under-resourced? Because no matter where you're living, there are some exceptions, but usually if you're in a place where I'm living, or even where Soda's living, usually on the outskirts or some various places, you will have pockets of places where people are in massive need. So where can you begin investigating what those needs are? What organizations and resources exist there that you can begin collaborating with and having conversations with to say, hey, I'd love to contribute and talk about sleep. And once you do that, just like Soda was sharing, what specifically is affecting most of those people in that community? What exactly is going on that is the major underlying stress? Obviously, there's going to be a number of them, but usually there is a large major stress that they're all sharing together. So what is that? And how can then you begin to provide talks about that, open the dialogue, ask the questions, receive and listen to the information they're telling you, and then provide them customized tips that they can begin working with?
Yeah, I mean, I think it goes with me locally here where I live. I'm trying to do a lot with the school systems, right? Because when it comes to these conversations, making sure that they're, yeah, being at the table for these conversations. So I'm talking to a lot of the decision makers. You know, when it comes to some of the health disparities, you had mentioned things like, you know, light and sound pollution. It's also about building healthy communities. In our work, we talk a lot about the fact that light regulation is key to managing, right, that 24-hour clock in order to keep us healthy. But you see in a lot of, you know, impoverished neighborhoods where these bright LED lightings and lighting is coming in. And we know that even if you sleep with just a little bit of light, how that can affect your heart health, right? And if you're seeing these numbers, like making those connections, those correlations, like we're not building healthy communities. We're not creating a foundation right at the school level or like even on a professional level, having sleep education as part of the conversation in your office, having someone do a screening, do an education, you know, nurses talking about it in schools. There's a lot of opportunity to have this conversation, but we haven't started to. Now that people are starting to realize little by little the importance of sleep, but there's a lot of work that needs to be done in order to get it into the right places.
I agree 100%. And I feel even taking it further directly to the home, school is 100% important, but taking it directly to the home, because you can be in school all day and they can do what they can in the community. But if those parents don't have themselves their own resources to fine tune, to calm, you know, themselves, to emotionally regulate themselves, and the amount of stresses that they have, that's just going to naturally, unfortunately, and some children are more sensitive than others, but affect the children. Even if they don't have a discussion about it, the child will still feel the stress that the parent is going through. And as a result, they'll take that on as a burden. And so providing through the schools, even whether you're directly,
I do parent engagement sessions where we it's like an extension to the school and have those conversations with parents, but it's that connection together.
Exactly. Connecting everything together and providing those realistic tools, because when anyone's in the heat of the moment, and when let's say you had an awful day at work, you had a very stressful day, you just get home, you get your mail, the bill's coming in, you're not sure how you're going to pay your bill. You also have to get your child a meal. Your child is then needing you for something and complaining about something that they need because of their nature, which is, you know, a normal, natural thing. And everything is building up of inside you to the point where you're trying to do the best that you can, but it just takes that one moment where just things explode. And it's not because you're a bad person, it's because you're a human being. And the way that our society and culture is set up, with the limited amount of resources and the discussions that are not being had specifically and practically and realistically, next thing you know, it's like everything goes. And next thing you know, you're yelling, you're screaming, you yourself are having a hard time calming down. The child is feeling it, and there the date goes, right? And then this cycle continues until finally, whether it's through a school, whether it's through a workshop you attend, something you see or something you learn, you have a resource that is provided to you that you can physically use, you can emotionally use, that can support you through these moments that you're going through. So let's talk a little bit about that, the support. So we mentioned the dialogue, having the meaningful conversations, which in the schools, directly to parents, in the community, even having it as part of the local community, having those discussions and attending local community events and having those discussions, I think is important. But how can we begin asking for support? So as professionals, how we can provide support, and then for those that are in need, how can we begin asking for support?
Well, I mean, it's going to be unique to each individual in terms of what they need. Obviously, we can't make huge generalizations, but I think beyond things like going into the schools, going into employer groups, there's a statistic here, the last statistic, but I think it's pretty significant. According to the US Bureau of Labor, more than 45% of Black, Hispanic, and Asian Americans work frontline or shift jobs. So I do a lot with first responders and protective services, and this is working outside of that traditional 9 to 5. And Mara had touched on something that was really important, and I think it's something that we highlight through the International Parenting and Health Institute, and something, if you were to attend one of the workshops that are going to be offered, we talk a lot about how sleep affects our entire physiology, right? It affects our hormones, but it affects something as simple as our ability to concentrate. It affects our ability to regulate our emotions, right? To make decisions. It affects the way that we manage our, I think I mentioned aggression, our emotions. Like, so when it comes to like any kind of stress, whether it's financial and so forth, it affects our decision making. So it coincides with all of these different things. So I think it's really important, if you have that education, to understand how sleep connects to all of these different pieces, right? We start to learn why it's important to prioritize it, right? If we sleep well, we're a little bit more rested, we're better to make decisions, we're a little bit more calmer, a little bit more patient, maybe we don't have outbursts, things don't happen. So a lot of times things get out of our control because we are unrested, right? Or we experience that burnout, and sleep is a big part of that conversation. So having that educational piece and understanding how it's just as important as nutrition and physical activity, if not more, I think is going to be something that's going to be instrumental as part of the conversation in terms of health disparities.
Yes. And as business owners, leaders in your community, teachers, anyone who has the access and opportunity to directly engage with their employees, with their students, with their community members, and so on, it is so important for you to ask yourselves, how can I support the well-being of those that I'm surrounded by, that work for me, that I'm engaged with? How can I support them to show up in a way that they're not on hyper mode, right? Where their nervous system is not constantly in fight or flight. So you had mentioned the first responders. I did and participated in a training for that as well, specifically tied into yoga. And there's many other resources available for that. However, if you're in other, not necessarily first responders, but other kinds of shift work that you are in, how can we then, as health professionals, begin to collaborate with those industries? How can we begin having conversations and tapping into those businesses ourselves and providing brochures and information and education along with the school system? So then, therefore, we can start to provide the resources, because even though there has to be specific, like Soda is saying, we want to get as specific as possible. There are many different things going on, many root causes for the reasons why people are having the sleep issues, from physical to emotional and so on. So that's important. But opening the dialogue, having people starting to go into this world and understanding what are some of the baby steps that we can take? Like you had mentioned, sort of even the lights, like what are some things that we as a community, that we as business owners, that we as leaders, teachers, what are some of the things we can begin to do to then support this process, whether it's environmental, whether it's providing a physical resource, and so on?
Well, that's the thing that I say, what's great is that there's so much opportunity. And that's why, with the IPHI, what you're offering here in terms of the workshops and the type of information, a lot of this is things that we don't know. So I think the first thing is to equip ourselves with the tools to go out into our communities, right? So it's like having these conversations, but understanding, like, you might not understand completely the role that light plays in, sleep and our energy during the day, but also our ability to sleep through the night. So I think it's important to have that educational piece and then understand and to apply it. One of the biggest things through the International Parenting and Health Institute, and one of the reasons that I, decided to go through the certification program, a big part of this organization, is the investigative process. In sleep in general, whether in medicine or health right now, I feel that there's still a big missing piece. We try to make these huge generalizations about things, and it ends up not helping anyone. So through the holistic science of sleep method, it's looking specifically at an investigative process. So if you're a healthcare professional, say you're a nurse and you work in the mental health space, you're working with a particular type of individual. You need to understand, regardless of whether or not light is a tip or not, how does that relate to your specific demographic, who it is that you're speaking to about sleep? If you are a police officer, you work in, a hotel or in hospitality, how does shift work, depending on the type of shifts that you have, relate specifically to that type of work? So it's like, there are a lot of tips that are out there, but applying them specifically to an industry. So I think having the tools and a bit of that education, and that's how we're really going to get into those spaces, and we're going to really implement change. Because I think it all starts with that educational piece. I think is going to be the most important, because there's so much to learn, and it can be very overwhelming. But when you have a pathway to follow and you're thinking specifically about who is it I'm trying to help, how am I trying to help them, right? You can apply that information in a very meaningful and practical way. And I think that's the most important thing.
Absolutely. Get to know your community, get to know your audience, get to know who it is that needs your support and help, what they're going through. Ask questions, listen, what is happening. And the more you begin to learn and understand, then you will have an opportunity to then know what tools and resources you can apply for them. That's on the health professional space. Now, when it comes to anyone who's listening in, even though we are specifically catering this topic to health professionals, but if anyone's listening in and you're not necessarily in the coaching field or health professional field, and you yourself are listening because you're like, oh my gosh, I can relate. I'm living in an under-resourced community. I just happened to tune into this. What can I do? First, begin to ask yourself, what are the major things in my life right now that are causing the top stresses, like the top 3 stresses in my life? And where can I ask for help? I know asking for help seems sometimes, and a lot of times, especially for women, I feel embarrassing or feels like you can't handle it all. Asking for help is one of the most courageous and one of the most powerful things that you can do. It actually, I feel, when you ask for help, you become a leader. You become someone that you step forward and you show everyone that we're not alone, that each of us as human beings need help. We're not meant to live on this planet to do everything by ourselves and take everything on by ourselves. And all of us, no matter how well-to-do you are, all of us will come upon points in our life where we're going to need help. We're going to need help for something. So when you recognize and acknowledge that, you know what, I'm in a situation that's very hard right now. I'm struggling. What resources are available to me? Who can I ask help for? That is important to begin just acknowledging that, asking yourself these questions, and then reaching out. It could be reaching out to a friend. It could be reaching out to a family member that you trust. It could be reaching out to a local professional that, again, you have a trusting and good relationship with. It could even be reaching out to us, or even a business like Soda's, because she's very community oriented in hers as well. Reaching out to any of these organizations or anyone who you're intimate with and say, hey, I'm going through this right now and I need some help. Do you have any suggestions? I know some people who even go on social media and just share with their social media very openly. I'm going through the situation. Can anybody support me? If you are going publicly and you are sharing on social media, keep in mind that people will give you direct solutions, very well-meaning, well-intended. However, keep in mind that they haven't been customized for you. So be open to them, receive them, and thank them for that. But don't be so quick to jump to those solutions just yet, until first you go through that thorough investigation process to understand, how can I be best helped? So just take all that in. But once again, if people just throw out solutions, don't just go trying every single one without first knowing, and investigating what needs to be done to support you best.
Well, I'd like to just take a quick moment, just I guess, to do a slight plug, because as the IPHI has transitioned into nonprofit, Mara is actually opening up. We have a private group for our sleep community, and you're actually going to be opening that up to the public.
Yes.
Correct?
Yes.
So she'll drop that link below so that you'll have the opportunity to join that conversation. That's a private forum.
Thank you. Yes. So it's a private forum, but you can join. And the way to join is if you visit parentinghealthinstitute.com, you're going to see a tab on the menu that says join our online community. Click on that. You're going to fill out a form. It's free right now, so anyone can join. And basically what we're doing is we're having weekly live streams. When you send in questions, we're going to be reviewing case studies and supporting you in any way that we can, because we understand that, again, every situation, although there's general tips and general information that are very valuable and we can absolutely all gain from and benefit from, at the same time, when you're hearing specific questions being answered, when you're hearing case studies and how they're specifically being resolved, that's helpful. It's helpful then to take things deeper for yourself. So feel free to join us there. And if anyone is out there and is needing just a direction, maybe you just need to be directed or guided to where you can find resources, feel free to contact Soda and myself, because we have a ton of information and resources, and we can definitely guide you on where you can get started or who you can turn to support you.
Absolutely.
All right. I think that wraps up today. So thank you for joining us. Thank you for being open to this incredibly important topic and conversation. We want to encourage you and inspire you to go out there, learn about your communities, understand what's happening. When you're in the field that we're in and you're able to support so many people and you're able to touch lives, there's nothing better than knowing how big of a difference you're making, not only in those individual lives, but in your community. So we want to inspire you to just go out there. And again, if you don't know how, stay tuned, because the work that we're doing with our nonprofit is going to be sharing more information on how you all can do that for your communities. Thank you. And we look forward to joining you for our next live sleep chat, which is going to happen on the first Tuesday in March of 2023. And if you want to learn more about Soda, you can visit her website, startwithsleep.com. She has an incredible business with an incredible amount of resources. If you want to learn more about becoming an integrative adult sleep coach or a holistic pregnancy and child sleep consultant, you can visit us at parentinghealthinstitute.com to learn more. Thank you for tuning in.